Hello everyone, and wish you all a very happy 2024. I hope the new year has kicked off on a happy and healthy note for each one of you. You're joining with What Matters to Her Facebook video series, your go-to resource series for questions related to women's health and pregnancy. And as always, we are privileged to have our dedicated expert obstetrician and gynecologist, Dr. Probhodana Ranaweera, with us. And I must say, he is so amazing that despite his busy schedule attending to his patients in hospitals and students in the university, he still finds time to dedicate his knowledge to educate women about women's health and pregnancy matters during these discussions without a single charge. And that is amazing, and we are ever so grateful for you, Doctor. I just wanted to make that appreciation before we kick off our very first episode this year. All right, without further delay, let's get started. Doctor, could you please enlighten us on VBAC, vaginal birth after Caesarean delivery? And in your answer, please also explain if a mother can have a VBAC if she has undergone 2 Caesarean sections before.
Right. Okay. So VBAC is vaginal birth after cesarean section. It's the same as if in America it's called TOLAC, or trial of labor after cesarean section. Both are same terms in 2 different continents. That's all. And now for currently the VBAC is safely done after 1 cesarean section, but there are new evidence to say even after 2 cesareans it's possible. It has been started in UK, but in Sri Lanka we have not, planned it as such. But we had deliveries where 2 cesarean section coming, about to deliver, and we have allowed it without any complications. However, we cannot do a planned VBAC with 2 cesarean section at the moment. Second thing is now. To qualify somebody for a VBAC, there are certain criteria. The first thing is to see whether the scar has healed, because the main problem of the main complication of VBAC is that the old scar, or the scar at the uterus, is given away during labor, and that is emergency, and that can harm the baby as well as the mother. So because of that, the VBAC should be conducted in places where immediate cesarean section can be done if there's a complication, or what we call a category 1. The facilities are available for a category 1 cesarean section where we have to deliver within 30 minutes from the decision made for a cesarean section. So because of that, and also there is a 1 in 200 chance of this old scar giving up. So that is where we are worried that is a well healed without any complications. So at the moment, the qualification for VBAC, or somebody to undergo VBAC, we have to check whether the scar is healed properly, and also whether the scar is suitable. So the scar suitable is decided by there are certain scars at the first cesarean section which may contraindicate a vaginal delivery. So we call it a classical cesarean section, or the scar in a vertical aspect to the uterus where they should not have a VBAC. And also if there are complications during the first surgery where we call it tears. So so there are 2 types of tears, which both of them are if they happen during the first cesarean section, we don't it's contraindicated for the cesarean section, contraindicated for a VBAC in the following pregnancy. Second, if there had been infection of the uterus or uterine scar soon after delivery, which usually the patient should give a history of fever after delivery, there are pus discharge soon after the first cesarean section, then we assume the scar is not healed and we cannot give a VBAC for those patients. Then in the current pregnancy, whether there are any, contraindication for a vaginal baby, like breech presentation or any other complication which may contraindicate vaginal delivery, then we cannot offer VBAC to that woman, obviously. The third one is that interpregnancy interval. That is, from the first Caesarean section to the current pregnancy, it has to be at least 2 years or more at the time of birth of the second baby. So in that cases, we can allow for a VBAC. If it is less than that, then it's a risk that the patient is going to take. So that's about VBAC. So we have certain criteria. Not all women will qualify for VBAC. And then the women who qualify for VBAC, they have to have the scar, the normal scar that we usually do, and they should have healed properly. And the interpregnancy interval should be at least more than 2 years. And current pregnancy should not have any contraindication for a vaginal delivery.
All right. Thank you very much, Doctor, for enlightening us on the intricacies of VBAC. And in our next episode, we delve deeper into this topic. So stay tuned and have a lovely day.